Butt wings are a common compensation for squats, but usually when we see them, a lot of times we don't really know why it's happening or what we should do to truly fix it. So in this video, I want to talk about why this happens from a biomechanical standpoint. And once we truly understand the why, then how to fix it becomes a lot more easier. And so we'll talk about 3 different exercises that we can start to implement to improve a butt wink during a squat. So the first thing we need to understand are the 3 different phases of the squat. They can be represented by 0 to 60 degrees of hip flexion, 60 to around 90 degrees of hip flexion, and then 90 to 120 or full range of motion. Now, what's happening in each of those phases is really what is going to cause or not cause a butt wink to occur. Let's talk about normal first. During a normal squat, if someone can achieve full range of motion, no butt wink at all, what should happen is phase 1, they're moving into more external rotation. Phase 2, slight internal rotation. And phase 3, they're re-externally rotating. When this happens, when the pelvis can move in this fashion, what we'll see is that the leg can travel in a straight path. So we're not going to start deviating, going into knee valgus, a lot of things that we see. Additionally, when we can achieve this relative motion of the pelvis, we're not going to start to compensate with the lumbar spine. So that's normal. What about abnormal? What about when a butt wink occurs? So when a butt wink occurs, normally what happens is we have 0 to 60 external rotation where we normally can achieve that. Then we have our second phase, 60 to 90. That's where we have more internal rotation. And normally the person can achieve that. But phase 3 is where the problem occurs. If you think back to the normal range, we need external rotation from 90 to 120. So the pelvis needs to be able to externally rotate and kind of close off in the back. Well, if a patient does not have this available motion because of the position that they're in, the pattern that they're in, potential stiffness, limitations, then if the pelvis can't externally rotate, then the next segment above is going to externally rotate. Now, what we see is flexion, but flexion is a synonymous term with external rotation. So we can't, or the person can't achieve external rotation and flexion through the pelvis, which allows and creates a little bit more space for the leg to move straight. So what the brain does is it says, in order for this leg to move straight, I can't move here, I'm going to move as a unit. When we move as a unit, we are going down into that squat, then we cross that 90-degree threshold. The brain senses that the pelvis cannot dissociate from the spine, so the lumbar spine dumps into flexion, a posterior pelvic tilt, and as that happens, the whole pelvis dumps into a butt wink. And so when you go down, you go into flexion to find that space, and then you whip out and you come back up. And so this is the butt wink motion. It's the brain's best attempt to remain in a normal upright position and find flexion. It needs flexion. But if it cannot get it through the pelvis, it dumps the entire unit, aka the lumbar spine and the pelvis, dump into external rotation and flexion. So that's why, from a biomechanical standpoint, we see a butt wink during a squat. Now that we understand the true problem, what do you think we need to do to solve it? We need to start giving exercises that increases awareness, that improves the overall position and ability to dissociate the pelvis, as well as we need to choose exercises that helps promote external rotation at the pelvis. Why? Because that's what we need from 90 to 120. We need a little bit of external rotation to give us the space for the full range of motion. So now that we know the problem, let's go through 3 easy exercises that you can start to implement to fix this. So like I mentioned, the first thing we want to do is start to increase the patient's or the client's awareness as to how do we get in this greater than 90-degree position and not just totally lose our pelvis position. So what we're going to do here is a unilateral stretch. I say quotations because it is a stretch, but the goal is not to truly stretch things. It's more of the awareness and getting into that position. So what you can do is you can use a squat rack. A Smith machine's even better because you can just start to elevate and get into higher ranges of hip flexion. But if you don't have that, a squat rack's fine. You could use a bench, anything that you have. That what you want to do is throw their leg up into this position where they're above 90 degrees. Yes, we're getting a lot of good stretch, which is nice, but remember the true intent of this exercise is to get into a little bit of a better position of the pelvis. And the nice thing is as you go into the slight posterior pelvic tilt, you're going to get a stretch on the right side, aka we get that nice quad hip flexor stretch. Now the other reason why we're choosing a unilateral compared to going down into a bilateral is because unilateral allows for the pelvis to rotate a little bit. It allows for a little bit more movement and freedom. Compared to a two-leg stretch or a bilateral stretch is going to compress more structures. And chances are this person's too compressed. We need to get them to move a little bit. So go into each side, work on can we get into a little bit of a better position, a slight posterior pelvic tilt. As you do that, you should feel a hip flexor stretch. Make sure that we're really conscious and that the patient or client knows this is really about position. The next exercise is a greater than 90 hamstring bridge. So what we're going to do is we're going to make this a closed chain exercise. Why? Because a squat is a closed chain exercise. It's also going to give us a better ability to control the pelvis. So we make it a closed chain exercise by making sure our feet are on the wall. So it's definitely better to do this on the wall with a bench or a box compared to doing it off the wall. Throw a ball in between the knees. That way the legs can really not deviate. Remember, we want to truly make sure that the legs are staying in a straight plane. So you're going to get really close. And once you're really close, you're going to probably have to get a little bit closer till you are above 90 degrees. Why? Because we know that the problem usually happens above 90 degrees. So in this position, I want to get grounded. Feel the wall. Make sure your heel, midfoot, toes, everything's in contact with the wall. Next, this is a position drill, but also an isometric loading drill. Can we improve the position to get greater depths of our squat in a way that uses the right muscles and we don't compensate out of it? So we want to start to contract concentrically glutes and hamstrings. Those muscles are going to help to posteriorly orient, aka provide the necessary compression to allow for a vertical squat without a butt wink. So what do? We go into a slight posterior pelvic tilt. We should feel the ribs go down. We stay grounded on the wall. Then we slowly dig our heels down without losing the wall. All we're going to do is hold this position, feel the hamstrings contract, feel the glutes contract. It should be relatively easy for the person doing it, but they should know that these hamstrings are working. Lastly, we're going to start to load it, but we're going to be intentional with how we want the patient and or client to set up. Going on a heels elevated slant board is going to start to promote a posterior weight shift. Why? Because if you go on this and you don't do anything, you're going to fall forward. What your body does is it starts to get here instead of prevents that forward fall with a posterior weight shift. That posterior weight shift is going to compress the posterior pelvis, which is what we need to remain upright, but not only to remain upright, but we need that to provide space to allow a greater than 90 degrees of hip flexion squat, aka it prevents a butt wink. And you should see this pretty quickly. When you throw someone on here, they're usually going to improve their depth and their butt wink's going to start to go away. Why? That compression and the better position of the pelvis allows you to go through the motion without compensating into your back. So feel free to load this up with a goblet squat, a safety bar squat, something with more of an anterior load. That anterior load really allows for that posterior compression, same thing. So that way, as we go through it, we're not butt winking.